we're going to really address the issue of heart health, particularly for women today. Most ladies out there, you need to really pay attention to this. We love you. We want you around. And taking care of yourself it's a priority. Should be. A lot of gals don't. They don't make it a priority. When you look at the numbers out there, 60 million women, that's 44% of the population in the United States, women population, are living with some form of heart disease. Heart disease is the number one cause of death in women. 1 in 5 female deaths will occur from heart disease. That's not acceptable. And much of this is tied to lifestyle. Lack of exercise, the wrong kind of diet, too much stress, not prioritizing you. So my show's here to help you prioritize you. And one of the first steps that we need to take, ladies and guys, I'm not leaving you out of this mix, is exercise. This is according to the Huffington Post. Women exercise less than men. And that could have consequences for their physical and mental health alike. On average, men are nearly twice as active as women, getting at least 30 minutes of daily exercise according to a recent study published in the journal Preventive Medicine. That's particularly bad news for women, the researchers say, because their comparative inactivity puts them at a greater risk of metabolic syndrome, a descriptor of a cluster of related conditions such as high cholesterol, belly fat, and high blood pressure that often leads to heart disease, stroke, and type 2 diabetes. It also is associated with higher levels of depression, the researchers found. The good news, there's something we can all do about it. The results indicate that regular physical activity participation was associated with positive health outcomes for both men and women. However, there were greater strength of association for women. Now, here's something, ladies, you probably don't know. And even though this is Heart Month, when you look at the cardiovascular system, we're looking at blood pressure, things like this. More women die from strokes than men do. You don't want that to happen. All relates to the same thing or things. Lack of activity, wrong diet. Lack of activity, wrong diet. And there's a lot of things you can do to help prevent this. First and foremost, make a commitment to exercise. Set a goal. Get a friend. See a pro. Get that help. Nothing wrong with that. Next thing is look at your attitude towards food. Food shouldn't be used for comfort. It should be used for nourishment. But too often we use food for comfort. And the foods that are most addictive to us are foods that are high in sugars, commonly referred to as carbohydrates. And when you eat those sugars, what happens? It stimulates the pleasure centers of the brain to give you that quick fix that you feel good about. Then what happens after that? The guilt sets in that you feel bad about. Why did I just do that? You just basically self-destructed your whole day to get that quick fix. Now, to make you understand how this actually works when we look at the heart in general, the first stages of heart disease is inflammation. When you have inflammation in the body, things basically are in a breakdown state. In this case, we're looking at the heart. When you have inflammation in the arteries, yes, in the arteries, a crack forms. We call this a lesion. Almost like if you cut yourself on the outside. Only this is in the arteries. Then the body goes into the repair process to take care of this problem. The inflammation causes a rushing of what we call C-reactive protein or cytokine reactive protein, literally, to go where this injured area is at, okay, to go there and tackles on this stuff to keep control of the cytokines, which causes inflammation, and let the immune system kick in to start to heal. So when we look at the inflammation, we say, what's causing that? Lifestyle. Bad diet. Not enough activity. Not enough rest. Too much stress. Now, all the science out there is, I mean, you've got major universities researching inflammation and low-carb diet right now. Yeah. From heart disease to cancer to Alzheimer's, all the way down the line. Now, they call it the keto diet. I call it the low-carb diet because I was doing this way before they took the term keto and made that popular. Keto refers to ketones that the body releases to be used for energy when you take in less carbohydrates, lower carbs. Interestingly enough, these ketones have healing properties. Interesting, isn't it? And one of the properties that they serve is to take down inflammation. Bet you didn't know that, did you? So the longer you're on this type of diet, the more healing occurs. Also applies to cancers and Parkinson's and Alzheimer's. I can go on and on and on. Epilepsy. All this stuff. Pain syndrome. So when you look at the heart in general and you have inflammation that's chronic, the body's in a repair process to patch up the crack that's formed in the arteries, and it does a good job of it, sometimes too good of a job, which causes a blockage, basically a stenosis in the artery, a closure. But did you know that 70% of all heart attacks occur with people with normal cholesterol? Mm-hmm. Because that lesion is not closing. It's vulnerable. They call it vulnerable plaque, where it keeps eroding into the artery wall until at a certain point it ruptures and a blood clot forms to stop the bleeding. Bad place, though, in the heart. Now you have a heart attack. So the key is to try to reverse this process by changing your lifestyle, and that means diet and exercise. Ladies, I'm sorry, we can't get around that. I'm addressing you today. The guys are next week. Diet and exercise. Because we know that when you look at, in general, the statistics that are coming out, people that have blood sugar above 90, yes, increase the risk of heart issues by 300%. Yeah. So next time you look at your blood work, ladies and gentlemen, if your blood sugar is above 90, you got an issue going on. Mm-hmm. Cleveland Clinic's been using that number to measure pre-diabetes since the early or late 1990s, early 2000. Yes. And statistically, 80% of our population over the age of 55 are pre-diabetic or diabetics. 80%. Boomers. Less than boomers. That's huge. And a good measurement for this is the belly. Look at your belly. The average female in this country has a 39-inch waist. 39. OMG. Guys, you're a little over 40. 39 in a gal. Back in the 1960s, 70s, the waist size in females about 25, 26 inches. We put on 13, 14 inches in that period of time, all in the belly. No wonder we're having more heart attacks and more strokes. And this could be Heart Month. They can designate it as Heart Month. Of course they could. And they did. What good is it going to do unless you pay attention to that? Fortunately, you've got a lot of information out there to help you make these decisions. My show's one of them. Now, here's a decision you can make because, ladies, you're having a hard time getting into an exercise. I understand that. I don't feel good going to a local gym. And I won Mr. Universe twice. Don't go to a local gym. Get a professional like us to work with you. So I'm looking at this information. You know how I'm a believer in exercise, particularly the kind I do. We use a system we call PHA, stands for peripheral heart action. Literally what that means is the periphery, arms and legs, things that stick out the side here, the squeezing action of those muscles. Okay, you're moving around the body like a pump. So you're moving upper, lower, upper, lower, upper, lower. Okay, so it's highly effective in circulation, in taxing the cardiovascular system to benefit how the blood flows through the body. So here's some interesting information for you may not have heard of. That pumping action that comes out of your lower body, this is from Corporate Wellness Magazine. The soleus muscle, or soleus muscle health, preventing secondary heart failure and blood pressure. Now, the soleus muscle is the muscle that's the deep muscle in your calf, lower leg. It says there the output from your heart, known as cardiac output, is completely dependent on a venous return to your heart. In other words, when you push blood out of the heart, it goes through the arterial system. Arteries are muscular, they squeeze. And it comes back through the venous system. Veins are not muscular. They have little doorways. Okay, so when the muscles squeeze, it pushes the blood through one chamber into the next. The door closes behind it to keep it from going backwards. And it pushes it back up to the heart and lungs to get fresh oxygenated blood, and the whole process keeps occurring. Well, we have 65,000 miles of blood vessels. Half of them's through the venous system. It says here, when a person is lying down, there is minimal gravitational influence on the flow of the blood in the body. So adequate venous return can be ensured by low levels of venous pressure. However, when sitting or standing upright, the venous blood in your lower limbs must be returned to the heart against the force of gravity, requiring pressure well above the usual pressures in the vein. To overcome this challenge, the human body relies on skeletal muscles pumping to return pull venous blood as well as interstitial fluid back to the heart. 3 lower limb skeletal muscle pumps exist: the foot pump, the calf muscle pump, and the thigh pump. In other words, the muscles below your waist. There's 3 pumps. Okay, foot, calf, thigh. The foot pump serves primarily to prime the calf muscles, because if you can't pump the foot up and down, the calf doesn't work, which provides about, listen to this now, 3/4 of the fluid return from the lower body to the heart, while the thigh pump provides the remaining quarter. In other words, if you're not working the calf, or the soleus, which is the deep muscles where these veins go through, you're not pushing blood adequately. So it goes on and says, in the absence of movement, though, for example, while seated, muscle pumping is created almost exclusively through the activity of the soleus muscle. These are specialized postural muscles in the calf of the leg, which contain large venous sinuses that store blood until a reflex response activates contraction of the muscle. This results in the production of sufficient pressure to return venous blood, as well as lymphatic fluid back to the heart. The soleus muscle, the calf in that area, are so critical in returning blood to the heart that they have become to be called secondary hearts of the body. The cardiovascular system in an upright person should therefore be viewed as a 2-pump system when the cardiac muscle circulates blood and the soleus muscle returns pull blood and lymphatic fluid back to the heart. So that is extremely critical when it comes to blood pressure maintenance, is to get those muscles to squeeze blood when you're in a resting state. That's why I tell people, the more toned, the stronger these muscles are, the more sufficient or efficient they work in pushing blood. So the heart's not working overtime to get that blood back up to the heart and lungs. And when we get older, one of the things that older people do is what? And I consider myself in that category because I'm almost 69, is we sit too much. So you're not getting the pumping effect of those lower limbs to squeeze that blood. But when your muscles are strong in tone, then even in a sitting state, they're still squeezing and pushing that blood through the venous system to return it back to the heart. So subsequently, blood pressure comes down, lessening the risk for a stroke or other issues that accompany that, like inflammation, things like that. So when you exercise, you're getting that effect. But the correct exercise is very important. You just don't go down to the gym and get yourself on a treadmill, okay, or pick up a weight, do a couple sets, and sit down and talk to your friend. You need to keep moving around. In our system, we do that. There is no resting in between. And then on top of that, when you look at the body in general, they talk about postural muscles. Those are muscles that help you stand upright. They're constantly contracting. Yes, like your abdominals, like your lower back, like your glutes, your butt muscles, extremely important. And back stability. The neck muscles, which hold the 16-pound bowling ball up. And your secondary stabilizers, the muscles between the shoulder blades that keep the shoulder blades back, taking stress off the chest, off the pec muscles, and helping the posture. So when you do all these things, circulation improves. It also helps the alignment of the body, less stress on the joints. If there's less stress on the joints, less wear and tear, less inflammation, less pain. So take this into consideration, ladies and gentlemen, that you're sitting at home when it comes to the heart. When you're sitting in a chair, pump those toes up and down, up and down, up and down, up and down, and up and down. Stand up every hour. Do 10 or 15 toe raises. Okay? Even in your chair, do 10 or 15 toe raises. Put some pressure on your knees with your hands to get that pumping effect to make those muscles work harder. It'll make the heart work less. So what it talks about in this article is cardiac output. When you look at heart failure in general, it's the amount of blood that leaves the chamber, particularly the left ventricle that supplies blood to the body. It helps it do more. Because when you have heart failure, the left chamber does not empty. It doesn't empty in normal states, even in a healthy heart. About 55 to 60% of blood has to leave that chamber. Anything below that is what we call failure. It's working overtime to get that blood out. So the pumping effect of the calf muscles of the soleus helps that work. So it's less pressure on the body to do that. And no medication can take the place of pumping or getting those muscles working. None. All right. We're talking about the heart again. Here's something. Listen to this one. You'll love this. Exercise versus drugs. This is from Tufts University. So, once in a while I bring this thing up, okay, because you need to hear this. It says here, doctors should consider prescribing exercise as well as medication for some common conditions, new studies suggest. It found that exercise affects outcomes about equally as well as prescription drugs for coronary heart disease, prediabetes, and stroke. The research did not specify what types of exercise work best for the different conditions. The study was what is called a network meta-analysis, which allows researchers to compare evidence from many existing studies on different types of treatment for the same disease. The review examined 305 randomized controlled trials with 339,274 participants. We want to see how much evidence there is with rigorously designed studies on exercise versus the most common types of intervention in medicine, medication. The evidence suggests that exercise and many drug interventions are often potentially similar in terms of reducing mortality during rehabilitation after stroke, prevention of diabetes, and secondary prevention of coronary heart disease, according to a study published in the British Medical Journal. Goes on to say exercise, not pharmaceuticals, provided better outcomes. You get that now? Ladies, men, provided better outcomes in patients rehabilitating after a stroke. In the case of coronary heart disease and prediabetes, exercise and drugs had about equal outcomes. So in other words, the exercise worked as good as the drugs when it came to heart disease and prediabetes with the exercise alone. It goes on to say at the bottom here, I think we need more studies. It says, in particular, far more evidence. He has that we should do more studies on drugs, noting that many medications used by tens of millions of people have only undergone clinical trials for 500 to 600 people. 500 to 600. Where you're looking at 339,000 with exercise. 500 to 600 people basically to get a drug approved by the FDA, and you're going to be taking this stuff. Look at Ozempic and those drugs. Having all kinds of problems with medication. I don't mean to get upset. All kinds of problems with those medications because now we have millions of people taking this stuff instead of changing their lifestyle. Okay, is it worth increasing the risk of pancreatitis? You want a problem? develop pancreatic cancer. Then you got a real problem. Thyroid cancer, gastroparesis, where you can't go to the bathroom. In fact, did you realize more people are showing up in emergency rooms because they're overdosing on Ozempic and those types of drugs? Overdosing and saying, oh, I didn't and you tell me you don't know how much you're taking? They weren't overdosing accidentally. It was deliberately. It was deliberate because their weight loss stopped. So if I took more, it can't keep. No, it doesn't work that way. Let's go to Bob. Hi, Bob. How are you? Is Bob there? You bring him up? Bob, how are you?
Yes, I am.
Hey,
Good.
Bob.
Hey, can you hear me?
I sure can, buddy.
Okay. So I just wanted to call in because I've been listening to your show, and you know I'm a client, and so I'm telling all your listeners now that I'm a client, and I just wanted to call in and just kind of tell you that I have been listening to your show for probably 4 years, and I wanted to call in and reach out and get on the program with you, but it took me about 2 years before I actually did. So and since I've done that, I mean my health condition
right.
and stuff. So I feel like I'm in good health, but the blood work says differently, and I've been working on it for the past 4 years, but 2 years with you, and I can 100% say that the exercise is incredibly important in anything that you do. Exercise and diet, and stay off the medication. I was diagnosed in 2020 with type 2 diabetes, and I changed my diet, and I think I contacted you. It took a lot of courage to reach out and make the commitment to do what you're. I'm still working on it. You know that. You tell me every time we have a session together that I need to keep sending you the journals and stuff. And I was religious about it at first, but I've slacked off, and I need to get back on it. But I think we all. I know what I need to do. I just need to do it. It's a lifestyle change, and it's not necessarily dieting. It's just changing how you think about things, how you look at things, reading the labels of everything that you're putting into your body, and that's critical. And I get sick to my stomach when I watch the TV and I see all these drug commercials on there, like you were just talking about, Ozempic and all these things that make all these great promises. And I just feel like I was on that metformin stuff, and that's just bad. Everything I read about that is bad. So, some of the good things that have happened to me is I just came from the eye doctor probably a week ago, and I have to do this now because my primary care physician wants me to go to the eye doctor because they can look into your eye, and she explained to me why this is and why you do it every year, because it's the one way that they can see inside your blood vessels without actually cutting you open. And they look into your eye and they can see in there. And she looked in and she said, it's a perfect picture. It looks fantastic. So I wanted to share that with you and your listeners that, the exercise and the dieting is paramount in making changes in your body, and it's totally reversible.
Totally.
If your doctors are telling you that you're type 2 diabetes, that's great. But they want to put you on prescriptions and give you drugs, and I'm just here to say that you don't have to do that.
Yeah, so you're not taking the metformin anymore either. You stopped it a long time ago.
I stopped it shortly after I started your program.
Yeah, it shows you the effectiveness.
I'm talking months after I started your program.
Yeah, it's about almost 2 years.
And my blood work shows that I don't need it.
Yeah, excellent.
My A1C was at 10.1 or 10.9%. They don't go any higher than that, and now it's at 5.9.
Yeah.
So it's come way down. So I just
it shows you the power of food and the power of fitness. No doubt about it.
Yeah, totally. And and it took me 2 years to get the courage to call you. You got to get past that with yourself, you know.
Well, that's most
and I had to do that.
Yeah, most people go through that. What they feel is intimidated factor, but because of the environment that you're training in, you know, our place, you know, it's just you and me, and of course, if Teresa's there working with her client or Nathan's with his, whatever it may be. Okay, it's just one-on-one. It's not a gym where you walk in and everyone's sitting around the equipment taking things up, and you're waiting to get your workout in. And it takes 2 hours. You're in and out. Okay, and someone really cares that you're there. It's that simple.
It's a 20 to 30 minute workout, and I feel like it could have been a 2-hour workout, and I'd have felt the same way. But the competition that you psychologically engage in when you walk into a gym with everybody else in there, you don't have that in your facility.
Yeah, because it's like this.
You're right. It's nice.
Yeah, I mean, I won Mr. Universe twice, and there's no way I'm going to walk in a normal gym. I'm not going to get in there. Okay, and these guys, they're younger guys. I'm not going to try to challenge one of them. I'm not a fool, okay, because I've worked with people in the past who went into a normal gym. They come up and see me because they hurt themselves because they train against a guy 30 years younger than them, doing dumb things.
Yeah.
Anyhow, I'm going to let you go. We'll see you on Monday, okay?
Yep.
Thanks for calling, Bob. Take care. Bye-bye.
Bye.
Yeah, Bob's a testimony in himself. We've got other people right along the same line as Bob who've lost tremendous amounts of weight, got off the medications because they followed the diet and exercise. Okay. And the accountability factor makes you stick with the program. Hate to say it, we all need some form of accountability for any things in our lives. Okay, no matter what it is. Okay, if you're accountable, you do a better job with things. Just like people stay at home, try to work from home. You don't work as good at home as you do when you go in. You have people that you're accountable to. The same thing applies. The most important thing to you ourselves is our health. If you're not accountable to someone, you won't follow through. And I hate to say this, even though you may have a doctor, you're not accountable to your doctor. You don't see him that often enough. So get yourself a professional who you can work with to help to make you accountable to your exercise and what you're eating, the things you're having the most difficult time in life to do. We've got about another 6 minutes. Okay, so I'm going to share this information for you. Okay, this is from Health in the News. The causes of heart attack and stroke include excess belly fat. Not only does this type of fat increase your risk of both, but also boosts the chance you'll have a subsequent cardiovascular event. It says here, according to new research published in the European Journal of Preventive Cardiology, having excessive belly fat can increase your chance of having multiple heart attacks and even strokes, regardless if you're on preventative medication. Get that one? There we go. A healthy diet and regular physical activity are the best ways to lower your risk of heart attack and stroke. As I said earlier in my show, ladies and gentlemen, the average, I'm not making this up, this is from the CDC, the average female in this country is a 38.7-inch waist. The average male is nearly 41. Yes. The average woman is about 40 to 50 pounds heavier than what women were back in the 60s and 70s. And males are about 30 pounds more. You don't have to have that happen. So if you're looking at risk factors for heart attack and stroke, and this is Heart Month, there we go. Excess belly fat is an independent factor, along with blood sugar. Blood sugar alone is an independent risk factor for heart attack. I remember back in the 1990s, for you to be a diabetic, the number was 145, I believe. Now it's 126. To be pre-diabetic was 120. Now it's 100. The number is actually closer to 90 because we know at 90 milligrams per deciliter blood sugar, it increases your risk factor for having a heart attack by tremendous amounts. At 100, 300% more. Don't let this happen to you. You only get one shot in this life. In the heart, you can't see what's going on in the inside. But know that what you put through the mouth that goes into the body is fueling all your biological functions. Your chemistry is made by the food that you eat. So if you're in a chronic state of inflammation, the heart is affected in a major way. Same with the brain. And medication does not fix the problem. Tufts University proved that. You have better results of a stroke when the person was exercising versus the medication. And one of the best ways to keep blood pressure down is a low carbohydrate. They call it keto. It's a low carb diet because the effect it has on different hormones that make you retain salt. Sodium is an essential electrolyte. You need sodium or you'll die. But if you're eating lots of carbs, your body retains excessive sodium, stressing the kidneys. You're not getting rid of it, and subsequently blood volume goes up and your blood pressure goes up.